Hello, I'm Dr. Seeds and I'm here today to talk to you about my exciting new supplement, Body Protection Compound, BPC. Really excited about what we've been able to do to bring this to the market, and it's first of its kind as an oral product. It's an oral supplement, and we are really making some changes and changing people's lives. This BPC product is something that people are able to utilize for recovery from workouts, from long days. What you're going to find is the body is going to find an easier way to repair itself and recover from the previous day's stress load, whether it's exercise, whether it's a mental fatigue type of process. This body protection compound has a lot of different ways that it can follow in bringing the body back into a homeostatic pattern. It has a lot of pathways that it works through in improving recovery, rejuvenation, and it's something that is definitely changing the game for a lot of people out there that have been searching for something to make an improvement in, let's say, just their general aches and pains, or their fatigue, or their brain fog, or things that have really not gone well for them over time. And I want to say this BPC really does have that general aspect of being able to hit many parts of the body systems. So let's say it's recovery for exercise, in taking care of muscle soreness, what we call DOMS, or the aspect of muscle soreness after workout. It really does work in recovering and repair and improving that time frame that people can get back at it with less pain. But it does assist in improving that reparative process. If it's something that has to do with GI issues, GI disruption, regurgitation, ulcer type of issues, gut permeability. The BPC is, interestingly, the peptide, the 15 amino acid that BPC mimics, is something that is actually made in the GI tract, in the gut. And we have mimicked this protein from what you naturally make. And that peptide has been found to have many restorative aspects of how it works in the body. Not only does it work in the gut, in repairing the intestinal lining, it works in muscle recovery. It also works in the brain by upregulating serotonergic and dopaminergic pathways. So it's got a really nice way of kind of, if you want to look at neutralizing or bringing back the homeostatic state of a cell, or improving the yin and yang of a cell, if you want to look at it that way. And I think it's a modulating type of peptide to bring a cell back to normal. The way we've brought this to you is we've been working for a couple years on designing a protein that starts out over 200 amino acids, and eventually when it gets to the stomach, it is degraded into this 15 amino acid sequence of the BPC-157 type peptide. And that's where it has its effects. When you see or you hear people talking about the potential that BPC does not work orally, I'm just going to tell you that's not true. And the literature has shown that oral BPC is just as effective as injectable sub-Q BPC or intraperitoneal BPC. Just think about it. I mean, the gut makes BPC. It's made in that environment, and it acts in that environment. It's a very, very functional and utilitarian type of peptide that has many uses in upregulating and improving repair. So it has been a workhorse for us in restoring function just on a daily basis for people who just feel like they've just worn down and they're not able to take their day on like they've done in the past. The other thing I think I needed to clarify is that, you get some people that send in some questions about fillers and flow agents that are used in supplements, and the ingredients in this peptide are basically amino acids, and then the others are excipients that are used to make sure that this peptide or this amino acid stays stable as it transmits into the GI tract. And that's all of those ingredients that you see on the bottle are necessary for that to happen and for it to be utilized. We don't have anything that's unnecessary. Track record is already being proven in the amazing stories that I'm getting feedback on and how we've been able to help people every day with all aspects of injury and repair, mental fatigue, gut issues, where people don't have to go to the drugstore anymore to use antacids or to use their PPIs to stop the acid reflux or acid issues that they have in their gut. I mean, this has so many aspects of how it can pertain to improving your health. And I want to say thank you for all of the interest, and I hope we continue to bring some amazing things like this and continue to improve your health and make you better every day.